Hello everyone, my name is Irene Kimani. I'm a nutritionist working in the Kenya office of the Food and Agriculture Organization of the United Nations, and I will present on a research-oriented project which was implemented in 2019 in one of the semi-arid counties of Kenya called Kitui. The title of the USAID-funded project was Trials for Improved Practices, and it combined nutrition education and rural livelihood support with the aim of coming up with feasible and sustainable solutions to child malnutrition. Kitui County was given priority because it is one of the counties with the highest stunting rates in Kenya, with about 5 in every 10 children being stunted. The project targeted 100 households with children aged between 0 to 23 months, prioritizing those with or at risk of acute malnutrition. So what is Trials for Improved Practices? It is a nutrition education methodology that involves trying and testing recommendations on improved child feeding and food-related practices in people's homes to see if they are acceptable and feasible to caregivers before wider dissemination. So throughout this presentation, I will refer trials to improved practices as tips. So when you hear tips, I mean trials for improved practices. So the tips methodology was implemented in 3 stages. The first stage involved preparatory work involving recruitment of tips implementers from the local community, and priority was given to locals who had a nutrition background or those who had previous experience in nutrition education, more specifically at community level. They included community health workers supported by the Ministry of Health and trainers of farmers who were supporting nutrition resilience activities within the bigger agriculture-based FAO projects. The tips implementers were then trained on tips and basics of nutrition education and counseling, as well as data collection, especially given that they would be involved in formative research that would document actions throughout the tips implementation period. So after the preparatory activities, followed the implementation stage, which involved combining formative research and actual implementation. The team started with community mobilization to sensitize community members and leaders on the TIPS process and to enroll eligible and interested households. The community sensitization was important to foster ownership and to help in prioritizing the most vulnerable households. The whole process was led by the county government, and more specifically the Ministry of Agriculture and Ministry of Health, who took lead in coordinating anthropometric screening for children in terms of mid-upper arm circumference and weight for height. And enrollment gave priority to households with children who had or were at risk of acute malnutrition. The team took advantage of the community mobilization to sensitize households on the need to relieve the primary caregivers of farm duties so that the project is able to improve on care practices. So after enrollment followed actual implementation, which involved visits to identified households to conduct formative research, or what we call initial assessment of the food and family feeding situation. And this would provide a baseline to guide formulation of feasible nutrition messages for individual households. So looking at the findings on the left side of the poster, the initial assessment showed that the most common feeding problem, which was affecting 64% of the households, was inadequate dietary intake, where children were mainly fed on 1 to 2 food groups, with starchy foods constituting a higher portion of the diet. Poor sanitation and hygiene was also a major concern. It was observed that animals were roaming near the household, especially around the kitchen area. Some households lack latrines. Also, water treatment and waste disposal was a major concern. Additionally, maternal workload was also impacting on care practices, as was observed in low frequency of feeding. So back to the methodology, based on the initial assessment or the formative research, messages were formulated and the TIPS implementers proceeded to negotiate with the caregivers on the most feasible dietary and behavior changes that will be tried out for optimal child feeding. The agreed upon recommendations were documented for future follow-up. The counseling visits were blended with some participatory approaches, such as development of seasonality calendars to aid in self-monitoring of the food available at different times of the year, to identify corrective actions, and to develop seasonal specific recipes. Other approaches included cooking demonstrations, both at household and group level, and caregivers would occasionally be brought together for cooking demonstrations to share experience. Cooking demos were also conducted at farmer group level under the bigger FAO projects. Households were also supported to establish kitchen gardens and were trained on vegetable preservation for year-round availability. The trainers of farmers who had rich experience from other agriculture-based projects within FAO supported this particular activity. The next step after the first counseling visit were 3 follow-up visits at individual households, and this was done concurrently with participatory approaches that I mentioned earlier. The TIPS implementers made follow-up visits after every 2 weeks to assess the progress and discuss other possible actions that the caregiver wished to try depending on the changes in the household food situation. This also involved, during this follow-up visit, though, they were also documenting what has been adopted and what has been rejected. And this would form part of the recommendation that would go into the wider dissemination. During the follow-up visit, they would also document the feasible recipes. The follow-up visits marked the end of the implementation stage and the beginning of the evaluation stage. And the evaluation stage involved analysis and collation of information on the acceptable and feasible recipes, feeding recommendation, and any relevant follow-up actions. It also involved final anthropometric screening of the TIPS beneficiary and generation of the final report. So when you look at the findings, at the lower part of the poster, the right side, the key results in terms of adequacy of feeding were all primary caregivers who were not adequately feeding their children adopted incorporation of 4 food groups with continued breastfeeding. This was because they were provided with feasible and practical options. There was also an impressive improvement in milk frequency depending on the age of the child. 87% of households who had a problem with sanitation and hygiene adopted hand washing during 5 critical times, or establishment of dish racks or cleaning food before preparation. And households also established fencing for small stocks such as chicken, goats, using locally available materials. The TIPS project also documented a total of 20 seasonal specific recipes, which were disseminated through trade and food fairs that were used in future projects. Studies show that impact of nutrition-sensitive agriculture projects is best measured through changes in diet quality, and indeed improvement in dietary diversity was more evident. However, we also observed an improvement in prevalence of underweight from 14% in May 2019 to 10% in October 2019. Thank you very much for your attention, and I am available for questions and comments through the email that I have indicated on the lower part of the poster. Thank you and bye.